Hi, my name's Nick Rutherford. I'm a physiotherapist and this is our clinic, Physio. This is our gym space where we take some of our classes. We often get asked quite a few recurrent questions, so we thought we would do a live Facebook feed and get people to send in some questions that hopefully we can answer for you. Enlighten you a little bit about physiotherapy, perhaps some bits about our clinic in particular that maybe makes you want to come and investigate and get some aches and pains perhaps sorted out. So this is Becky, she's our practice manager. She's going to be Magnus Manderson asking questions. So we've got questions that people have sent in, so we might refer, see us referring to those. You may also see us doing a bit of this as we look at the very small box in the corner of the screen. That is where the questions come through. So if you want to ask us something as we're going along, just direct message them in via the Facebook page, and we will do our best to answer them. So Physio is, as it sounds, a physiotherapy clinic. We also run some specialist rehab type classes, which are Pilates, Physio Run, Physio Mum, which are specific to pre-postnatal mums for the Physio Mum, and runners, novice as well as experienced long-standing runners with injuries, strength and conditioning class. We also have a couple of other therapies. And Ash, who are sports massage therapists, and we have Rachel, who's the CBT, which is the cognitive behavioural therapist. So there's a little group of us that are here through the week, hopefully to help you with any little issues that you have. So, yeah, let's go.
Question one.
Yes.
One of the biggest questions that we're asked, what is the difference between physiotherapy treatment, chiropractic or osteopathic treatment?
They all actually, when you come to kind of getting us all to give our little sentences about what physiotherapy is and chiropractic and osteopathy, they all actually read quite similarly, which is treating musculoskeletal disorders, be it of the joints, the ligaments, the muscles. The ways in which we and the sort of the ethos and the rationale behind are a little bit different. The physiotherapy is very, perhaps more predominantly exercise based. More and more research coming out that is looking at strength and support and efficient movement patterns. Chiropractic and osteopathy have been traditionally very manual therapy and manipulation specific. I'm not a chiropractor and I'm an osteopath, so my understanding is from a physiotherapy background. So physios tend to manipulate very little, but we do mobilise, we do hands-on treatment, but there's a much heavier bias now towards exercise. Chiropractic and osteopathy are adjustments and manipulations and some exercise addressing other things. So to the layperson, they actually sound very similar. People have perhaps tried all in one suits some people better than others. Physiotherapy is externally regulated by the HCPC, which is the Healthcare Professions Council. The others are self-regulated. Physiotherapy is predominantly NHS, so the vast majority of physiotherapists work in the NHS with a smaller proportion of us in private practice. It's the other way round for chiropractic and osteopathy. They are predominantly, vast percentage is in private practice. So I guess it depends a little bit on what your preference is, whether it's a bit more sort myself out maybe, which is a bit more physiotherapy perhaps. Chiropractors, if you like having much more hands-on treatment, then maybe that's the way. So perhaps in a nutshell, a bit more exercisey. Physios like to think we're very, very evidence-based, and obviously I'm going to be a little bit biased towards physiotherapy. Maybe that answers your question.
Question 2. When should I see someone if I have back pain?
Good question. The evidence says that I think 85-ish%, over 80% of back pain goes away in 6 weeks or less. So you're going to be very unlucky if you are still suffering 6 weeks later. People do, obviously. Now, probably my best advice is there are a lot of things that will be a bit sore for a couple of days. For example, you've been to the gym and you've worked a bit harder and things are a little bit sore for a couple of days, and then they settle down and they go away and you're fine and there's no long-lasting problems. If your back hurts, it could be worth giving it a couple of days, taking some painkillers and see if it's settling down at that time. If you are worried though, that doesn't mean you can't and shouldn't come in within those first couple of days, because we can perhaps give you an idea what's going on, a bit of an idea on time frames, and again say, well, this may only be a problem for a couple of days and then you'll be fine. There can be the things that are likely to be a problem for a little bit longer, but by seeing someone earlier rather than later means that those time frames are shortened, so that you don't have it for weeks and weeks and weeks on end, and you're actually a little bit more confident and doing the right things in that time. Yes, obviously you can manage it yourself, painkillers, and very much now keep moving, keep mobile. That doesn't mean carry on running or lifting furniture because you're moving house. It may be a case of just take away some of those aggravating factors that make your pain worse, but keep mobile and see if it starts to settle. But again, if you're ever worried and not sure, you just get on the phone and give us a ring. I can't think of any private physio that isn't going to give you some pretty good advice over the phone. So never really, maybe after a few days, maybe straight away if you're worried, or even if you've had it for years and years on end, there is invariably something that physio can do. So give us a ring.
Moving on. What is physiotherapy?
What is physio? I'll probably maybe answer that a little bit in the first question. So it's technically it's a health science. We are research-based practitioners. We deal with musculoskeletal disorders and conditions, looking at aiding recovery and well-being via a few different mechanisms. Some manual therapy, so hands-on, maybe electrotherapy, a couple of machines, acupuncture. As we said in the first question, quite a lot of exercise, so strengthening something, recruiting muscles in a more efficient pattern, educating the brain, so telling the brain when things should be working and putting that into context with the activity you're doing. So it's a rehab science, so very researchy based, and certainly over the last 10-15 years the amount of research that physios are doing is going up, and that's changing practice all the time, which is why there's a heavy emphasis towards exercise, because that changes how we move. Hopefully that kind of is a brief synopsis.
Okay. What is the most common condition that we see or treat?
Oh, easy one. Back pain, without a doubt. Back pain all day long. Thereafter, neck pain. Probably then it might be a little bit of a tie between shoulders and knees. And then you're into elbows and ankles. But definitely back pain, and even more back pain.
We've already talked about when you should see someone if you have back pain, but when should I see a physio for anything else?
Oh, I'll probably say the same thing. Again, most conditions, so there's a big caveat on that, most conditions do get better. Things burn out, our systems just move on, adapt, and things, aches and pains get better at avoiding doing certain things, or we just build our strength up or develop another strategy for doing it. So to be honest, if you haven't got endless amounts of money that you want to, I'll go and see my physio as soon as my shoulder hurts, my neck hurts, my back hurts, it is worth giving it a couple of days. If things have been hanging around for weeks on end, I'd probably go. So if you don't think your pain is getting better after that sort of crucial sort of 4 to 6 weeks, you've had it a month or so, definitely that's the time to come in. If it's definitely, 80-90% better after 3 or 4 days, that perhaps isn't necessarily, you're not rushing it to the door to come in and see us. So yeah, about that sort of time frame.
Do I need a doctor's referral to come and see a private physio?
No, you can self-refer. We always send, certainly our clinic, and it is that standard across the profession, we inform GPs that you've been to see us. We write very brief detail. GPs not necessarily interested in all the minutiae of what we've done with you. We just let them know that you've been to see us with a condition, and essentially whether we need them to do anything else in the process of helping you get better and make a full recovery. So you don't need to see them. We will tell them. If you are obviously concerned or worried, then go and see them and just ask whether they think that physiotherapy is appropriate.
On a different topic, is acupuncture effective?
Yes, acupuncture is on NICE guidelines, so National Institute of Clinical Excellence. That's the there's a committee that reviews evidence, and they look at evidence for everything to do with healthcare provision, so mental health, surgical, heart conditions, stroke, cancer, drugs. So they look at the research that's been provided, and they sift through it, and they look at the best kind of research, and they say, yes. Acupuncture is on there for tension-type headaches and migraines. It's the only non-pharmaceutical treatment for those conditions. It was on there for back pain. It's only recently, in the last year, come off. The physios that are into teaching acupuncture to physios and doing all the research for it are obviously a little bit frustrated because there is actually good evidence for it. The problem with acupuncture is that the type of evidence that NICE guidelines like is very difficult to do with acupuncture. So I don't want to bore you with ins and outs of double-blind studies and things like that. However, acupuncture can't be researched like that. So it's on there for headaches and migraines. It's not on there anymore for back pain, yet most of us would potentially recommend it for certain types of thing. It's a good form of pain relief, and there are lots of neurophysiology reasons as to why that is, as well as local physiological responses. So you have to be registered. So myself and the clinic here is registered to perform acupuncture. So it is a treatment that we use.
Okay. Before we move on to some of these questions, we've been asked a question
on
the Facebook feed. This person fell over just before Christmas. Her knee dislocated and she has a suspected second-degree tear to her quads and patella tendon. How long can she expect her recovery? She's nearly 8 weeks.
Flipping heck. It depends what you mean by recovery. So, injury, December. Dislocated knee. So by that, do you mean that you dislocated your patella? There are various terminologies for dislocating your knee. If you have significant ligament tears in your knee, that would be classed as a dislocation. Months would be my estimate on that. Secondary tears here. So weeks and weeks and weeks. So low level tears, grade 1s, you're perhaps looking at a few weeks to a month, 6 weeks. Grade 2, 6, 12, maybe even longer. And then when you're up to complete ruptures, you are months down the line. when you are looking at recovery, you do need to be progressively working those structures. So once you're out of the very acute phase, so perhaps the bleeding and the tears for the first 24, 48 hours, the type of rehab you're doing should change, and that should get progressively harder. So you're always sort of pushing the structure to get stronger and stronger. So those tears in quads should kind of be pushed. So the problem that you have, certainly with if you have yes, patella dislocated, yeah. So the problem with the dislocated patella, you get lots of apprehension. So a lot of patients struggle with that feeling of working that quad, which you need to do in conjunction with other muscles, is that it feels like it's going to dislocate again. So you kind of got one of these catch-22s where we're desperate to make you work it, yet the brain and the leg is going, oh, that's such a good idea. So that can slow down your recovery a little bit, but that's about really grading your exercise and making sure that you are doing the right kind of thing. So there are so many ways of exercising your quadriceps and your knee, and co-contraction work around that need to make it feel nice and stable. So we're both sat on balls, which you can't necessarily see. However, it's a really nice way of working muscles without the weight and perhaps without that, therefore some of that apprehension. If I move my ball back, if you can see, hopefully you can still, I don't know, Becky, can you see? I haven't got my, oh, hang on. By sheer vanity, I've taken my glasses off, so I can't actually see all that well. So things like working a seated lunge. This might be too easy for you if you are already. Perhaps you should be way past this at this point, but that's nice little things to do. Seated bounce work and balance, so you get lots of activity around at the knee and getting your arms going. So, I mean, like I said, that might be a little bit too easy, but don't be too worried if you think you're progressing slow, like a dislocated patella. Ooh, a lot of patients just struggle with that because of that apprehension of it again. So strength work, making sure it's in conjunction with other muscles and things in your leg, lots of balance work, and lots of trying to desensitize that knee. So that's about just exposing it to more and more. Very long answer to your question, but hopefully that's answered it. Feel free to put another question up if you want.
Right, next question.
Yeah.
What makes Plym Physio different to other clinics?
So, physiotherapy you can probably access at loads and loads of different places around Plymouth. We pride ourselves a little bit more on very much the exercise, so the research side of physiotherapy. That's where treating so many conditions, tendinopathies, arthritis, even some of the autoimmune disorders, things, exercise is key, really. So that's why we've got this. Now, I don't know how much you can see it there. We've got, which way do I move? So a big matted area, and we've got mirrors along two walls. So people could see how they move. So what we're trying to do really is get your brains, that programming, that processing part of movement, working with the body bits as well. So seeing how you move and deciphering it. Is that what I should be doing? Because that doesn't look quite right. Okay, if I do this, that feels better as well. So we like to think that we're very holistic in terms of, if you come in with, let's say for that patient, that person that's just put that question in about knee, we would be also looking at that, as we said, about that apprehension bit, so the brain side of it, and getting them doing work in front of the mirrors and on gym balls and stuff, which sometimes you could, most of the other private clinics in Plymouth have. Like I say, we also run our specialist classes, so our own Pilates classes, and Physio Mum, which is a pre and postnatal. We have exercise class, and then the Physio Run, which is a running specific strength and conditioning running class. And perhaps because we've got some of the other things here with the CBT and the massage, perhaps that's the other thing that makes us stand out. So,
yeah. We touched on a couple of the classes that we run. I've got 2 questions about them. The first one is, do I need to be running to join Physio Run?
No, not necessarily. We've had a few that have been very new runners, the ones that are starting off on their Couch to 5K programs. The basis of Physio Run is that when you look at some of the biomechanics around running, your body, legs are exposed to 2.5, 3 times body weight when you impact the floor. So that's quite a lot of force. So in your head, work out what 2.5 times your body weight is, and that's what your leg strength needs to be able to deal with. So that's quite a lot. And fundamentally, that is why running is one of the most injury-ridden sports. So 79% of runners have an injury. So that's massive. That's more than football and martial arts, anything. So the short answer for Physio Run is it's about getting you strong enough to run. So if you are strong before you run, you're probably less likely to have an injury. Ideally, you are strong in the right places to run. Equally, if you're starting running and you're doing the Couch to 5K and you know you can run for however many minutes, 1 kilometre, 2, whatever, then that's all you need. Our run section at Physio Run varies about 1.5 miles sort of maximum. We've got some that have been injured, so aren't running. So they do some walking drills when the rest of us are out running. Some can't manage 1.5 miles, so they've just done walk, jog with their drills on the flat bit outside. Some are ultra distance runners that are just can't cope with that distance anymore because they've got an injury. So we are picking apart a little bit, they've had an assessment, and then we are really trying to target their areas that need either a change in movement patterning or some strength work going on.
And the other question regarding Physio Mum, why should I join Physio Mum at the end of my pregnancy?
Yeah, we got asked this, didn't we, because loads were worried that they shouldn't be exercising that late in pregnancy. Short answer is your anatomy. So when you are pregnant and your muscles are stretched right around that big bump, they really struggle to work. There's an awful lot of pressure on your pelvic floor. That bump and that weight out the front tends to make us... I'm not pregnant, not anymore anyway. So not my water over there. Obviously tends to make us, and we get this sort of quite preggers posture, which just puts loads of pressure on your back, and our muscles are getting a bit weaker and they're struggling to go. So even if you're trying to do something, and I don't know how well you can see me if I shimmy back here, but just having a little feel of how, perhaps addressing some of you can, and some ball work that just starts activating the muscles, and we do lying down stuff, and it's very geared up to trying to keep things in check before everything goes south. And from personal experience, knowing how my body felt after I had my baby, I think the baby just sucked all the strength out of me, and it couldn't bend over. And I thought I was quite fit as well before I had my little girl. So that was a bit enlightening. So I sort of think if you can keep as strong and as mobile as you can pre-birth, then postnatal, life is so much easier. You think of all those horrible positions that you get into with nappies on floors and babies and picking up and hoiking, and if those muscles are just sort of deconditioned so much, it's again, there's probably not one mum out there that hasn't had some ache and pain in that sort of initial postnatal period. So the stronger you can keep, and obviously with Physio Mum, it is very tailored to your stage in pregnancy. So whether you're early days in your first 20 weeks or whether you are 36 weeks and feeling a bit enormous and you can't really move, at least you can be doing something. We just use equipment as we need to, nice loosening up stuff and just nice pelvic work. The class is an hour long, so it's not like you're doing this for an hour, obviously, but lots of variation on things, and it's designed to be specific to where you are in your stage of pregnancy.
Super. We don't have very long left.
Oh, okay.
So we're going to go to one of the probably very questions. Will losing weight help me?
If you are overweight, yes. Gone are the days where your GP used to sort of throw you out the door and say, don't come back until you've lost weight. But the short answer is the less weight you are carrying, the less load is going to go through your joints and muscles. So either it's much easier for muscles to produce the force to move you, or joints are under less load when you use them. So things, the classic is the arthritic knees, and you just losing a couple of kilos will really drop your ground reaction forces, which is that impact force. So if you're overweight, yes, it will help. There's also the tie-ins with general health. So if you are overweight, that does tend to then come along with associated other metabolic disorders. So things like diabetes, that we know influences tendon health. So you'll be more likely to get a tendinopathy. Unfortunately for women, we seem to be always given the short straw, but postmenopausal overweight women are the biggest high-risk group for plantar fasciopathy and other tendinopathies. So again, obviously shedding a bit of weight means that there's less load going through your tendon, but also again it tends to clear up perhaps some of the other healthy tissue or unhealthy tissue problems. So if you can, everyone always feels better for losing a bit of weight anyway, but it can make a huge amount of difference for lots of aches and pains and actually tissue health and recovering from certain conditions like tendinopathy.
Okay, final question.
Yeah.
We often get asked a lot about what happens during a treatment session. We have been asked, how much does it cost? And what happens during an initial assessment? Do you treat me?
Right, so your initial assessment of Physio is about 45 minutes. It will cost you £50. In that session, we get your medical history. So we want to know whether you've got things like diabetes, a history of cancer, any things that might be relevant to your problem that you've come in with. We get a full history from you. So when did it start? Do you know why it started? How's it progressed? What makes it worse? What makes it better? So we want to get as much information out of you as we can. Sort of liken it to, you've got a bit of a jigsaw puzzle and you get all these little snippets of information, and hopefully by the end of that chat, that first bit of the assessment, we've got a rough idea of what it might be. It could be A, B, less likely to be C or D. So we could very quickly rule out D and C, and then we're working on confirming whether it's A or B. So the physical examination is then we test certain things. We look at movement patterns. So if you've come in with, well, I sort of get a vague side of my knee pain when I'm running, then we will look at your knee, but then we will start looking at running specific movements. So squats and lunges and hops and things like that. And once we've kind of worked through all of those things, we then go, okay, so we think it's this. Well, if we did this, this might help. So we might try bits of treatment out. So if that's a back pain or a neck pain, it might be that we get some hands-on treatment into you, and then we check whether that's moving better. And then we go, okay, right, so if that does help, then we will give you some exercises because we want to keep that moving better. So your assessment is getting a history, getting an idea of what it is, checking whether that fits, and then doing a little bit of treatment to see, yes, that's going to help, and then send you off with your homework. And, you know, it's not like an interview. It's, you know, we want you to relax because we want to get as much information out of you because that makes our life easier. The more information we get, the hopefully quicker we can get to a diagnosis and get to the bottom of your problem and help you get yourself better. Hopefully, did I answer that question? I'm a bit waffler, sorry.
Yes, that's fine.
Yeah?
That's all we have time for.
Great. Well, if you are watching this live and you're watching this because it's still on Facebook and it's today, tomorrow, however many days away, feel free to put some more questions through to us. We will put some responses back on the Facebook page. If we end up getting quite questions, we will do another perhaps Facebook session, and we might make it, I don't know, joint specific. So maybe we'll look at shoulder joints, maybe we'll look at backs, maybe we'll have a look, see what people want to send in. So if you've got any more questions for us, send them in and we will pop some replies back to you. But you can always check out, we're going to put this on the website.
Yes.
Yeah,
hopefully.
so you could, if you do watch this live and you don't, you can fast forward it. We've got a library of videos and exercises and stuff on our website, www.plinphysio.co.uk. If you go to our blog section, we've got quite a few bits and pieces in there if you want to go and have a look at that. Or if you've got any questions, you can always phone us. So phone number 656340, and again, we'll do our best to answer them for you. Okay, thanks very much for tuning in, and see you again. Bye.